My name's Boland. I'm an M1/MSTP student. I'm originally from Grand Rapids, Michigan. I was an art major in undergrad and then joined AmeriCorps and did AmeriCorps for 2 years, and I worked with people with disabilities, did kind of an art therapy focused recreation. My frustration in the work that I was doing in AmeriCorps was I felt like I was meeting and reaching people at a point where there wasn't that much that I could really do for their health. I could do some to kind of help their quality of life, but in terms of what I could do to really help them health-wise, there were limited options. I actually heard about University of Iowa through an art history professor who I took several courses with, who did her graduate work here. And she had always kind of talked about University of Iowa as a really strong research institute, and so that was kind of what made me think about University of Iowa. So when I was looking at programs, this was one that kind of fell on my radar. In the interview process here, I definitely felt a warmth from the people that I was interviewing with. I feel like people were really interested in hearing about my story and hearing how I'd kind of developed an interest in medicine, and so I felt like very encouraged to kind of celebrate the journey that I've been through in order to get here. And so I feel like I didn't always feel that at other schools. I feel like Iowa in particular is really embracing of people who come from a diverse background. The white coat ceremony, I think it has a good place of kind of being a symbol for this entry into a new profession and an agreement of the responsibility that you're going to take in providing care to a patient. I think that's really the hope in the ceremony, is that you feel that weight and that gravity of the contract that you're kind of coming into as a physician, as a medical student. So I feel like I definitely sensed that during the ceremony, and it was nice to kind of have family there to witness this transition. The new curriculum is really working to kind of integrate more of a clinical experience with the early basic sciences. So throughout kind of our basic science training, we're getting a lot of clinical correlation, so diseases that might be highlighted by a specific genetic mutation. So when we're going through genetics, we're still kind of having our eye on the clinical side of things. In addition, we're doing these early clinical experiences where we're placed with a mentor in the Iowa City area. For me personally, I've always kind of benefited from having a balance between kind of the tangible hands-on component with more of a conceptual learning. So that's always something I've sought out in both the way that I studied art and the way that I was hoping to study medicine.